Hello, good day, and welcome to my channel. My name is Kemilawa and I'm an orthopedic surgeon. And today I'll be talking about elbow injuries in children, what to do and what not to do. Elbow injuries often occur from falls onto the hand, and most of them heal quite quickly once they are treated properly. It's important to avoid tight splints like the plague and to understand that problems often arise after healing when stiffness resolves. You must never force a child's elbow to move as this could damage it. How do children injure their elbows? They could fall from heights such as trees, swings, monkey bars, and even trampolines. They could also have falls while running at high speed. This is often worse on slippery tiled floors. And they could also have falls onto the elbow itself. What should you do when you suspect an elbow injury in a child? Look at the hand to see that the hand is still pink and warm. This is because the blood vessels that eventually supply the hand and forearm pass right through the elbow, and anything that causes increased swelling or pressure on the elbow could cause compression on these blood vessels and then compromise the supply to the forearm and hand. You can support the arm with a simple sling or even a large scarf folded into a triangle, and you must go to the hospital to have a clinical examination and an x-ray. Fortunately, most elbow injuries in children can be treated with a cast. Who needs an operation? Fractures that are displaced would frequently require an operation to put them back. These often have a lot of swelling and are at high risk for obstructing circulation, so you must be careful to present to the hospital as quickly as possible. They are often quite hard to miss. Fractures that are also at high risk for eventually displacing or for healing slowly may also require an operation. An example of this is the lateral condyle fracture. How do we care for the elbow of a child in cast? We must apply a sling for support. We must be sure to ensure that the fingers keep moving to maintain circulation, and we must keep the cast dry. Different methods of keeping the cast dry are practiced. You could simply towel bath the child to be sure that you do not run the risk of having water get in during the period of a shower. This might suffice for a smaller, less active child. You could use a lot of cast protectors, which are commercially available in most pharmacies, and you could improvise with bin bags and cling film. You must be careful to be sure that no water gets into the cast, as the moisture could cause irritation to the skin. You should be sure the child never puts objects into the cast to scratch, as these could get trapped in the cast and cause abrasions with a lot of soreness resulting. How do we prevent stiffness after elbow injuries? Do nothing. And again, I say do absolutely nothing. Elbow stiffness in children resolves slowly but predictably once they are left alone. This process takes about 3 months. Forcing the elbow to move often damages it and causes the kind of stiffness that is impossible to treat. What can the orthopedic surgeon do for you? The orthopedic surgeon can monitor progress after healing of an elbow by measuring the degree of movement. He or she can advise on safe types of movements to engage in as well. The x-rays can be analyzed to see if the cause of stiffness is bony, and in a few instances where the block to movement is bony, surgery can be used to improve this. The best time to see the surgeon is at the time of injury when a proper decision taken on time can help to solve and prevent later problems. What should you do if you have gone to the bone setters? You must avoid tight splints because of the risk to circulation, which is often made worse by the fact that the elbow is already swollen. You must watch that the child's pain does not increase. Once appropriate treatment has been instituted, pain should rapidly reduce and stay down. You must be sure that the fingers do not swell or change color and become either purplish or bluish. And if you find any of these concerning features, increasing pain, swelling of the fingers, or a change in color, you must remove all the splints immediately. You should avoid manipulations to get the elbow into place, as true elbow dislocations are quite rare in children. A simple X-ray will show you if the elbow is dislocated, and this can then be appropriately managed in the hospital. Muscles suffer irreversible muscle death once they have been strapped too tightly for 6 hours, and this leads to a problem in the forearm and the hand called Volkmann's ischemic contracture. Volkmann's contracture is very difficult to treat and impossible to completely reverse, so it is best avoided. What should you do if you have a child whose elbow is already stiff? Simple painkillers for a few days if the child is still in pain are helpful. You must stop all forced manipulations of the elbow. You can apply ice packs wrapped in towels for 5 minutes twice a day to the elbow and encourage the child to use the elbow himself or herself in normal activities. Chores are a great example of normal activities that can safely help to improve the range of movement of an elbow without causing damage. Simple things such as helping you with the dishes, helping to lay placemats on the table for meal times and cutlery, helping to turn on and off appliances, and using the hand to operate simple devices such as the remote, and yes, playing computer games, unfortunately, will be useful to help to improve the range of movement. Most children will improve their range of movement themselves because they have a desire to get back to active play, and often they can be trusted to do just the right amount of physical therapy required. What are our take home points? Elbow injuries are common and they often result from falls onto the hand or the elbow itself. Most of them heal quite quickly once the alignment is proper and a safe splint or cast is applied. Stiffness is often caused by aggressive movement by an adult, and preventing stiffness or improving stiffness is quite simple. Do absolutely nothing. And when you have hit the maximum range of movement that you feel the child can achieve by doing nothing, this would be a good time to see your surgeon for advice. Surgery has a small role in improving stiffness in cases where there is a bony block. However, the best prevention is still greater than treatment. Thank you, and please subscribe and like. Do let me know if there are specific things you would like for me to talk about. And do have a good day. Bye.